New Jersey board-certified plastic surgeon Dr. Ramtin Kassir took on the challenge of helping Susan reverse her look as our cameras followed along.
Hey Susan.
Hi.
How are you?
Very nervous.
How are you doing?
Very nervous.
The key thing here is this eyebrow needs to come down like that. This lip needs to be debulked from inside. And then this just needs less volume in it. I see this as a very challenging surgery. The eventual goal is to have Susan be able to walk down the street and have people not be able to see anything unexpected. Let's plan on this being probably one of the last ones that you do.
Oh.
Ever.
I would be thrilled. Absolutely thrilled.
The first thing that we find is a suture pulling this back. This is anchored all the way down here. So if we release this, it'll release a lot of this. My plan for the cheeks just got a lot easier because now they're descended to a different position, so now they just need to be contoured. We're subtracting fat. And the fat's been put in multiple different layers under her skin, so it's not where it usually is. Okay, I think it's time to do the lips. We just removed some scar tissue and some extra fat, and we're finished.
Susan's facial plastic surgeon, Dr. Ramtin Kassir, is here with us now. Thanks so much for being on the show.
Welcome.
For getting involved in Susan's care. Before I introduce everyone to Susan, I do want everyone to take one last look at her before picture. You all anxious to see Susan?
Yeah.
Well, let's see how she looks after 2 8-hour surgeries as well as 2 months of healing. Come on out, Susan. How are you feeling?
Oh, I feel overwhelmed. I feel amazing. And I feel like this has changed my life. And I've gotten my confidence back. I just feel just unbelievable.
I love hearing that.
And I do want to, just for the sake of everyone at home, I'm going to have you look in that camera, and I'm going to put side by side your before and after picture, because it's, you know, this isn't something we've done on the show before, where we talked about. And the most important thing is, we're going to talk about what you did in a second, but the most important thing is that you're happy.
I am. And I'm still in the healing stages, so I have quite a bit of recovery. So, but at this point, I feel wonderful.
And you look wonderful, too.
Thank you so much. Thank you.
And of course, Dr. Kassir, we've talked about a lot of surgeries on the show before, but how do you go about essentially reversing 29 surgeries worth of change?
What we did with Susan is the big issue was bringing this high arched brow that was tight as a drum down. So, and she had no hairline. The hairline was over here. So we had to take hair-bearing scalp from back here and interpose it in front of her scars, bring the hairline down, and believe it or not, this whole complex was able to come down 1.5 inches. And then we did some fat and scar debulking from her cheeks, from her upper lip, and then we took her muscle layer that was underneath and repositioned it so it would support her eyelids and not distort the eyelids.
What's amazing to me is, in a world where we look at someone and say, well, have they had an operation done? It is amazing to look at you now and literally see someone who looks more natural.
Much more natural. And this is not an operation they teach us in residency, undoing things, because we weren't seeing these kind of things. Nowadays, with more volume going in and doing some of these mid-face things, that's what altered her appearance.
Susan, you look fabulous. Thank you so
so
much. Dr.
much.
Kassir, great work.